Good morning, everyone. Welcome to another of our World Reimagined Social Care series. It's really lovely to have you here today. I am Sheena Arthur and I'm Partnership Manager at Glasgow Council Voluntary Sector. And my colleague Lynn has been in touch with you to get you here and organise our event. So a huge thanks to her. We've got another great discussion coming today. I'm not going to delay too much, but just to welcome you all sincerely. We have a great range of organisations, people who use services and carers as well. So you're all very welcome and please participate as much or as little as you would like. And just to say these events have really been informing the practice, the discussions we're having around policy. I work with the Health and Social Care Partnership and they're really informing the discussions and more importantly, what happens next. So thank you all for being here. I'm going to pass over to Penny Taylor, who's our amazing chair and host for the day, and delighted to have her here facilitating the conversation. So thank you all.
It's my absolute privilege. Thank you very much and welcome to all the people that are joining this call. We've got people joining in from all across the United Kingdom and even, I understand, from Canada. So welcome to you all. So great that we can get stuck into this vital discussion. As you've heard, my name is Penny Taylor. I'm a journalist who specialises in health and social care, and I am finding these discussions revelatory in terms of what we need to do with the formation of our new National Care Service in Scotland, and I'm sure the same applies south of the border. Just to let you know, we are recording, so you know, if you've told your significant other that you're off walking the dog, but actually you're taking part in this and you don't want them to know, then put your camera off, and there'll be other ways of anonymizing. But we're really encouraging your input to this. We really want to hear what your questions are when we get into the discussion. We have a chat function. If you scroll down your Zoom screen, it should reveal a panel along the bottom that includes a chat function. Click on that and it opens a panel where you'll be able to see how people are interacting. So please stick any questions, any comments, any links that people might find useful in there as we go through this session. Although an hour sounds like a really long time, I promise you it goes incredibly fast, particularly when we're talking about subjects as chunky, let's put it that way, as this one. So just to remind us, we're talking about hopes for a national care service and what it means in particular to people with motor neuron disease. I'm going to introduce, to start us off, Susan Webster, who's Head of Policy and Campaigns at MND Scotland. We're then going to hear from some other people who have personal experience of this, and then we open it out to wider discussion before we close at noon. So, Susan Webster, hi.
Hi Penny, thank you very much. I'll just kick off by outlining first a little bit about motor neuron disease, then I'll go on to the problems that people can face when they're trying to access social care, and then our hopes for the National Care Service itself. So first of all, motor neuron disease, or MND, is a rapidly progressing terminal muscle wasting illness. Average life expectancy with the illness is just 18 months from diagnosis. Within that time, people can lose the ability to walk, talk, breathe and eat unaided. About 450 people have the illness at any one time, and about 130 people are diagnosed every year. So essentially with the illness, people are becoming increasingly paralysed over what is a relatively short period of time. They can start off just needing one carer for, say, 2 visits a day, to quite quickly needing 2 carers, maybe 4 times a day. And then, you know, as the disease progresses, they can end up needing overnight care and ultimately 24-hour care as well. So what we found for people with the illness is that social care just can't really respond quickly enough to a degenerative illness like MND. People with the illness basically can really struggle with waiting times, as their care needs increase. And unfortunately, many people with MND can feel pressurised into going into a care home. And we're talking about really, relatively young people feeling this pressure, when really, understandably, all they actually want to do is spend their final precious months they have left at home with their loved ones. And that is really, really critical to people. We were really happy with the announcement and the commitment to a national care service by the Scottish Government. We'd actually called for that in our Scottish Parliament elections manifesto. We had felt that for a long time there'd been a postcode lottery, and it really needed to change. However, with that in mind, the National Care Service must be flexible and responsive enough to be able to deal with the needs of people with an illness like MND. It's really important that there isn't a low baseline, one size fits all service. People with MND will eventually have quite intensive social care needs, but sadly, this is for a limited period of time. And the National Care Service must be able to respond and provide this. A fast tracking process as part of this is really essential with an illness like MND. Caring for somebody with MND is understandably a 24/7 role, and the needs of carers must be prioritised. Carers assessments must be fast tracked, and there must be flexible person-centred respite as well. And we also need investment in a sustainable care workforce to have the capacity that we need. And with that, we really need 15-minute care visits to be a thing of the past. Mid-morning first visits and early evening tuck-ins must also be a thing of the past, because that really can massively negatively impact on a person with illness's quality of life. And in the meantime, while we wait for a national care service, it's really important that we start to see positive changes such as these rolled out now. We're talking about people with a terminal illness, and they don't have 5 years to wait. So we don't want all the good things that can happen to be put on hold for the National Care Service being introduced. We really want to see that now. Thank you.
Thank you so much. It's a really great scene setter. Now I'm going to talk to someone who has very personal experience of being a carer of someone with MND. Can I introduce, please, Ainsley Gibson? Hi, Ainsley.
Hi, everyone. I'm really privileged to be here and do this in my mum's name.
Thank you so much for taking the time to share your story with us. Before we start, tell us a bit about your mum.
Oh, our Esther. She had many names and was many things to many people. So here you go. Here is our Esther.
Great.
And that was her at her best on a luxury cruise in Hawaii.
Beautiful.
So yes, my mum was second born of 7 children. She pulled rank as the most important, bossiest one because she was the tallest. She was a nursery nurse first, then a nurse, and she practiced being a nurse all of her adult life. Her greatest achievement, other than our 3 wonderful children, I'm the only daughter and I was the favourite, was being part of an elite team within Kilmarnock, within the care home sector. They ran Lisdene Nursing Home in Kilmarnock, my mum, my auntie, and then my other auntie. So they all looked after each other. They were all nurses, they were all palliative care nurses. When my mum retired, becoming a granny, she had 5 granddaughters and then latterly a grandson. She was the baby whisperer, so we really needed her on hand just to tell us how to be parents, and she was wonderful. So when she retired, it was just so amazing to see my mum be everything other than a nurse. We really enjoyed it. She was a ballroom dancer. Her and my dad well, we were all born in Canada, so they used to spend about half the year in Canada. They would abandon us and come back when we needed us. And then I would say about 2016, that's when life changed, and my mum presented with a dropped foot. And back and forth to the doctor. She never ever prioritised her own health. She cared about everyone else, and it was only us annoying her. Please, mum, this isn't right. She had to stop dancing. She had to stop driving.
Did she
really
know
depended.
what was happening with her nursing background?
Well,
did she know what was happening with her?
No, she had 2 artificial hips. She blamed lifting and laying her entire life. She thought that the titanium hip, which was the leg that she had a dropped foot on, she thought that it had poisoned her system. So point blank did not want to have another surgery. She said, if this is as bad as it gets, it's fine. She thought she had injured herself in one of her many escapades, and she'd been in the Amalfi Coast and had been hiking up mountains and having a rare old time, and just thought she had inflamed something wasn't right within her leg. Went back and forth to the GP.
How long did that take to get the diagnosis? It
took far too long. So this was about the 2016, that was when my youngest was born, and she came back from the Amalfi Coast and just had an irritation in her leg and then presented with a dropped foot that year. So it took about 8 months for her to actually be referred for any neurological testing. Our GP point blank said it's just a dropped foot. It's a dropped foot, did not diagnose or did not look into it any further. Again, it started to become more apparent that it wasn't just a dropped foot, that my mum was actually becoming less mobile and her muscles were deteriorating. And then in the January of 2017, she was first sent over to neurology for it to be investigated. And I found that for every, we'll send you over and get investigation, it took almost 6 months for anything to happen. She was then treated with like the prosthetic supports within her shoes. And I kept asking, but what's the cause of it, Mum? Like, rather than us spending so much time at these appointments for mouldings, can they not investigate?
What was, so when she was finally diagnosed, how long did she have left by the time?
That's probably upsets me more than anything.
I'm sorry.
So from 2017 to 2019, it was back and forth and back and forth. She didn't present as having MND. She could swallow, she could chew, she could speak eloquently. She just didn't, it wasn't categorized as a motor neuron disease. They thought it was something wrong within her spine. It was back and forth between urology and osteo, and it took far too long. Unfortunately, my father passed away really suddenly in April 2019, and that's the same month that my mum was diagnosed with motor neuron disease.
Now, the caring fell to you, Ainsley. Yes. So once you got the diagnosis and you knew what you were dealing with, how did you as a family approach this? Because tell us a bit about yourself. You were working.
Yes.
Your partner.
So I had, I've got 2 little girls. My husband's a lorry driver. He works away Monday to Friday and he comes home at the weekend. My mum and dad were my support system. I certainly found that the roles completely reversed within that kind of 18 months. When my dad became ill, we realised that we had to come up with some other sort of plan, because at that point my mum needed help in and out the shower. It was easier for my dad to right, you answer the door or whatever it is. My mum just wasn't as mobile, but wasn't in a wheelchair at that point. I then started to phone like East Ayrshire Council and say, look, social care, what support can my mum have? I'm working, so I'm not there in the morning. I can't stay with my mum if I've got 2 young kids, blah blah blah. So that's when they started doing the personal care visits for my mum to have a shower in the morning. And then those started to increase. It wasn't overnight. It took about just under a week for that to happen. She had to be assessed. Care plans had to be created, and I felt that took too long, to be honest. I was going down and helping my mum shower in the evening, which I knew my mum. I knew it wasn't what she wanted, but it was better than nothing.
Yeah. No, your mum finally, and I'm so sorry, and my condolences with you. She passed away in November 2020.
So she was diagnosed in 2019.
Yeah.
At that point, she probably walked maybe about 3 weeks later than her diagnosis. I felt like the diagnosis completely whipped the rug out from under her. So she was in a wheelchair and steadily became more in need of care thereafter.
Yeah. Now, then COVID hit. What was your experience?
We had a small window between April and the end of the year for, well, this is what it's like with life with motor neuron disease. And we bought a mobility scooter, we bought loads and loads of things to try and fulfill my mum's life, because she was not the kind of person that wanted to stay in. And then
did you have all the help you needed to maximize her experience and yours?
MND offered a kind of bucket list fund.
How did you find out about MND? Tell me about how did you make connections?
In the hospital where my mum was diagnosed in Glasgow, we were told by the neurology specialist that they had discovered that my mum had MND, and in that same breath, she introduced us to our MND nurse.
Okay, so there was a specialist nurse.
Day, there was a specialist there, and that nurse stayed with us the entire time my mum was alive. She put us in contact with everyone else through MND. So we had the financial support officer who quickly told us, right, let's get everything in place, because I had spent so many hours in the social care office trying to understand what PIP was, what the attendance allowance, and because my mum was diagnosed like the week of her birthday, her 67th birthday, she didn't qualify for PIP. So didn't qualify for disability allowance or
so you're in this field that you know nothing about.
No, I spent hours and hours.
Yeah. So then COVID happened.
Yeah.
You know, towards the end of your mother's life, those last few months, what was the effect of that on you? I
personally feel that it amplified my mum's distress, her illness. I feel like everything moved rapidly thereafter. When she stopped going to her clinics, when our speech therapist couldn't come, when I felt like my mum fell off the radar.
How did MND Scotland support you at that stage? What did they offer?
Phone calls. I mean, I was always able to phone and say, this is happening and I don't know what to do. And quite often, understandably, the nurses, it's straight to voicemail and they'll get back to us.
And this is the MND specialist nurse based in the NHS, not MND Scotland. Yeah.
No. So probably my biggest gripe is that I felt like everything had to be crisis point before anything took place. I was very much a prevention, and what can we do to stop this from happening, or what can we do to stop this becoming an issue, like trying to get a hoist in place before my mum was left in bed for days on end because the carers weren't allowed to help her out of bed.
So
she
did you get
herself.
You know, how did you make contact with MND Scotland, and what did they do to help you?
So the MND nurse within the
health service
within the health service had given us like a list of, here's your contacts within MND Scotland. And when we went to the first kind of carers and MND sufferers, it was in the Gales Hotel, it was a support group. We got lots and lots of information there.
Yeah.
My mum was she really didn't want to go. She felt not embarrassed. My mum was a nurse. She was a retired nurse and she cared for others. So I think that having empathy for others was quite overwhelming when she was going through it herself.
Yeah.
And she quite often left these events feeling like, oh, I'm lucky. Yeah. These young men, these young strapping boys, Bulbar MND, my mum had never seen it, and it was just horrific in her eyes. So she always felt like, I don't deserve the same.
Yeah. But what about support for you then as well? You know, that you're being helped to cope when you're left with the burden of the caring single-handedly. I
was later on provided with a phone number for the advocacy support.
Yeah.
And I felt that once I had that, and I didn't know about it.
Yeah.
Once I had you, it was it was life-changing.
Okay, well, do you know what? That's a really good cue before we come back to you, Ainsley, about what you would like to see changed. All right, I'm going to come back to you on that one. I'd like to introduce at this stage Susie Sturrock, MND Scotland advocacy worker, to describe your role. What do you do, Susie?
She's a superhero.
Thanks for having me today. Ainsley, I am really humbled to hear about your mum before MND took over. That's not something that we are normally privileged to hear about, and it was lovely to hear about your mum, you know, ballroom dancing and so on. Love it. Can I just say, so my job as an advocate is basically to come in when a family are going through what exactly Ainsley described, where they are trying to work through a system that isn't entirely clear. I always say you don't know what you don't know, and when you find yourself in that situation, your only focus is on your loved one, and you want to get the best for your loved one. Trying to wade through a process of systems is almost entirely overwhelming on its own. So my role when I come in to work with a family is to support them to work their way through that system. I'm that middle person. So essentially, I would chat with Ainsley, discuss with her what she and her mum and the rest of the family needs, and then I would make contact with the social work team. I would look at getting equipment, adaptations, whatever the family needs in place. My job is to access that on their behalf and access it speedily. Unfortunately, the systems that are out there within social work, etc., they're not speedily. So the difficulty is always me as an advocate pushing and pushing and pushing against a system that generally just says you're in the queue. You know, your referral has been received and you will be seen 6 to 8 weeks for an assessment. People with MND don't have 6 to 8 weeks. I always say that the person with MND is as good on that day as they'll ever be. From there on in, they're always going to progress.
Susie, can I ask you, does everyone with MND in Scotland have an advocacy worker such as yourself to fight their corner?
They do. MND Scotland covers Scotland-wide. So we have 3 advocates in post, including myself. And the 3 of us cover Scotland-wide. So
okay, there's 130 new diagnoses per annum. You know, could there be more of you, do you think?
Definitely. And that's something that actually MND Scotland are looking into just now. So hopefully that will expand.
Now, Susie, sticking with you, from what you're hearing about the National Care Service, and given your experience, as I say, of fighting the corner of people with MND and their families, what do you think the government needs to do to improve the situation for people with MND? I'm going to come back to you as well, Ainsley, on that one.
Personally, I feel that there needs to be an investment. I think one of the difficulties prior to COVID was there isn't enough carers for the amount of people that require that service. Social work services offer maximum 4 to 5 visits per day. If your needs go over that, then the only option that's offered is a care home environment. That's not acceptable. People should have the right to be able to exercise their control and choice, but they can't do that because there's not enough carers. Local authorities have budgets that some local authorities are now putting a cap on the maximum amount a person can access for their care needs, and if their needs go over that cost, that person is liable for the additional costs. People can't and shouldn't be expected to pay for that when they're in crisis. Definitely an investment is needed.
And Ainsley, from your perspective, what do you think needs to be done for, the other families? 130 people are diagnosed with MND every year in Scotland. That's a lot of people affected. Yeah,
it was certainly my mum's wish to stay at home, and I think a lot of people, especially during COVID, I wouldn't have been able to spend any time with my mum if she'd been taken into any sort of facility for care.
Yeah, through the COVID thing, you wouldn't have been
through
able to see
COVID,
it.
I wouldn't have been able to be with her at all. And that time that I spent with my mum, it meant everything. The thing that probably was most difficult for me was when I was begging for more help, I had to go between Marie Curie nurses, the Ayrshire Hospice and East Ayrshire Council. So the social working team worked really, really hard, but they were stuck between a rock and a hard place. You can't have overnight support. And where they tried to work with me and Marie Curie nurses, it was a lottery. If you had a nurse that night, you found out that day. And where the shortfall was, I then had to stay overnight. I was still expected to go to my work the next day, look after my kids. I look back in that time and it was a blur. I don't remember the conversations. It was a really, really tough time. And then Susie was the one that took over for me.
I was going to say, what difference, I mean, forget that she's here listening in to us, but what difference did she make to you and your experience in family?
So before Susie, I was begging for support from anyone that would listen. My godmother in Canada got on the first plane out of Toronto and came and supported my mum for a month to give me a break. That's the kind of support that I needed. Someone that could come and take the pressure off of me. And there was nothing available through the social work department. And then when Susie phoned, first of all, I remember thinking, I don't understand who this person is. Like, why have I not met this person before? And then she explained what she could do, what she could offer for support, and I couldn't believe how much better I felt. I felt like my shoulders had been attached to my ears, and I was just this pressure cooker waiting to burst, and Susie just opened the hatch and just let me go. Oh, thank God. Like, it's not me that's going to phone. And I felt terrible. I would come off the phone to the carers, I would come off the phone to the social work department, and I'd say, I've got nothing against that person, but I'm so angry with that person. It was so frustrating.
It's, as you know, I think it was Susan said at the beginning, it's so difficult to understand the pathways through all this stuff. So you do need somebody on your side that gets that and knows how to
I know, because you've got a carer who's coming in to try and help my mum shower, for example, and they'll say you'll need to get occupational therapy to come and assess this chair, but you have to get, there was like so many hoops that I had to jump through and phone and get the right person to come out, and it never happened that day. And it was just, it was brutal. It was so brutal. So then Susie took all of that, like the negotiation, like if I can get in contact with this person today, then I can get them to action that for me, and at least it's only going to be 48 hours. It's not going to be weeks and weeks. But just trying to get the support to let me be my mum's daughter.
Yeah, how beautiful.
I begged my mum when we found out that it wasn't like a something that could be operated on. I said, will you come and live with us? And she said, Ainsley, I don't want you to be my carer, I want you to be my daughter. And I felt like because my mum wanted to stay at home, it took that away from me. I wasn't allowed to be a daughter. And that's not what my mum wanted.
Yeah, absolutely. Now, I'm really pleased to see that we've got questions coming in, because we're into the last half hour of this discussion now. So I really, really want to be able to reflect on what we can learn from Ainsley, your family's experience.
I wish, if anything, I had been introduced to Susie first.
Yeah, okay. Yeah.
That would be the only change to the process that I would say going forward.
Let me ask
Susie,
a question.
was it as important as the financial support?
And instead you feel like it was accidental that you found out about her? And
it was in crisis that I think.
So we'll come back to what we need to do there. But Kathleen from Cope has asked, you know, why are we told there's so much support out there for people, and yet Ainsley and others have to go through what she has had to deal with for 3 years? Susie, let me put that one to you from your perspective, working at the front line there.
The difficulty is, again, it goes back to people don't know about what services are out there to support them, and or not out there. They're caught in a whirlwind of making phone calls, being told you're on the list, waiting for someone to get back to them. Meantime, that family are still going through the crisis that they're going through. It's not improving, if anything, it's getting worse. And I think the frustration is that people assume that when you're in the time of need, you'll be able to make a phone call and social work services will be there to help you out.
Somebody will offer to help, as you have done,
But as is always the case, there is always a process, and the process is, I think, the stumbling block. And I think from MND point of view, certainly, I think, and you touched on it earlier, Ainsley, I think there needs to be preempting of future needs so that it's not reactive all the time, that there's a point where maybe diagnosis is too early to do that because people are still trying to get over the whole process of taking that in. But at some point, there needs to be an acknowledgement of what that person potentially might need going forward. So like the hoists, like, you know, all the equipment, adaptations and care needs, and having that discussion early.
Thank you. Susan Webster, Head of Policy and Campaigns at MND Scotland. You know, we've heard a really powerful example there of the difference that your organisation made in one family's life. But why did it take so long for Ainsley and her mum and everyone else involved to discover, for instance, that there's a Susie there to save them?
That would be hard to guess. Presumably it's been sort of lost in communication that Susie's there. Certainly from an organisational point of view, we do everything we can to promote the service. But
and of course, within the health service, for instance, you know, is there enough, when Ainsley and her mum first encountered it, was there enough information perhaps being shared?
Possibly
about the third sector?
Possibly not. And I think, you know, there just needs to be more capacity really in everything, you know, and particularly in, you know, in social care, there needs to be the capacity to be able to deal with this. And this is one of the main hopes for us. But yes, and then, you know, the kind of people that Ainsley would be meeting, you know, through the course of the illness, acknowledge, I mean, I suppose we're a relatively small charity, you know, and I think that's the battle that you have, is basically, you know, flagging up that we're there and we're there to do it. So.
But when it comes back then to Susie's point about investment, you know, would that be something that, you know, I'm hearing really strong support for advocacy. And let me refer back to some of the points that are being made in chat. I'm just going to read a couple of points because I want to talk about the role of advocacy as well as the third sector in any care service. Alex Thorburn writes, previously, people's right to an independent advocate was restricted to those with learning disabilities and mental health issues. With the arrival of the new social security powers for SSS, disabled people now have the right to an independent advocate to assist them with claims. However, there's still no right to independent advocacy for people seeking or using social care. What difference would the right to that advocacy make for people in the proposed NCS, that's National Care Service? If you're taking part, if you're listening to this discussion and you have any views on that or any questions to ask, please put them into the chat sector and we will get round them. Lynn has responded by saying the independent advocate system is not open to unpaid carers. And that, I think, is Ainsley's point there as well, that the support she got was as big, perhaps, or even more, Ainsley, than the support your mum got from...
Oh, definitely. And I think I had joked with Susie that when she got in contact with me about doing this, I said, is it sad to say how much I miss everyone? But yeah, the support to myself, I can honestly say that for everyone that I spoke to within MND Scotland, they were so gracious and caring for myself as well. They wanted to know how my family was, they wanted to know how I was doing. But
and nobody else was asking those questions when you were contacting them?
No.
Okay.
It was never really the impact. Well, for example, when I explained my circumstances, my husband works away Monday to Friday and I've got 2 small kids, so I can't stay with my mum. they put me down on the rota to be able to stay Friday night, Saturday night and Sunday night with my mum. So I had no relationship with my husband at all. So, and that's the balance that I'm talking about, the fact that I'm a human.
Person-centered.
Person-centered, and I did not feel like I had that.
Yeah. Okay, now here's a critical question. What immediate, so we're talking on the one hand about the National Care Service that's not due to be formed until 2026, but here's a question for us. What immediate changes are needed if we're really to see a change in system and culture here? Now that I think is, you know, a question that's more pointed at the Susan and Susie, but you know, if I could come to you first, Susie, you know, the crux of that question, what immediate changes are needed if we're really to see a change in system and culture?
It's a difficult one. I think first and foremost, budgets need to not be discussed. The amount of families that I have supported who have had a social worker tell them that they're at the maximum budget that they can get, or people don't need to know about funding budgets, etc. So first of all, that needs to not be discussed with families. That's in-house and should be retained in-house. Secondly, I think, you know, I work with many social work teams because we cover Scotland wide, we cover all 32 local authorities. The majority of social workers will say to me, I didn't come into this job to work out budgets and make sure that, you know, people are staying within a budget capacity. They went into that job to care for people, to be a support network for people in crisis. I think the difficulty lies with senior management and the whole aspect around funding. So for me, there needs to be more of a focus on looking at what does it cost for a person to receive what they want and need, and providing that irrespective of what that might end up costing.
Before I come back to Susan Webster, can I go to Ainsley and ask, you know, did you find that you were having to pay for aspects of your mother's care that you weren't able to, you know, how did it work for you?
Not so much my mum's care. It was more, my mum didn't qualify for a lot of things, so she had to dip into her savings to modify her house, to buy a mobility scooter, to buy a mobility car, those kind of things. But no, the care that was in place, we just had to, as I say, it was always like crisis point, and it was increased in crisis point, and other people were brought in.
Although, to come back to the speed that these things need to be progressed in terms of this particular condition, you know, you found yourself having to pay privately for.
Yeah, we had to pay privately to get the diagnosis in the first place. I wondered if my mum would have been in a wheelchair or unable to speak before she was actually diagnosed through the healthcare system.
So before we move it more widely into the National Care Service, Susan Webster, speed is such an issue here, we're hearing, yeah?
It really is. It's absolutely huge.
What do we need to do, and sticking with your field of expertise, to expedite this whole process? It's a very small group of people.
Absolutely.
In terms of numbers of people, and maybe if you're sitting, you know, adding your sums, you're like, you know.
But that's a good, that is a very good reason to do the things that we're talking about, because we are talking about a small number of people. We're talking about people with a terminal illness. Yeah. So Susie's very rightly highlighted budgets. You know, is it appropriate to talk about caps and budgets? That this isn't people who are ill for 30 years that are needing care for 30 years. You know, this is people that, yes, they need intensive care, undoubtedly, and they need that money then, but it's for a really limited period of time. And it needs to acknowledge that it needs to, the social care service now needs to be able to respond to people with illnesses like MND. They need fast track, that I highlighted earlier. Social Security can fast track people with terminal illnesses. The social care system should be able to
so there are models there, right?
Model is there.
Okay, cool. Now, before you, I move on from you, Susan, I wonder if I can ask, here's another question, basically saying, you know, do we need a similar model of advocacy and support that exists for MND across the social care system? You know, how do we ensure that the kind of work being done by you is supported as we move towards the National Care Service? I mean, are you going to get the funding to expand the number of advocates you have, for instance, do you think?
Well, we actually, our charity recognised the need for advocates. So we don't get any government funding for that. That is basically 100% funded by people who have lived through the experience, who are out running marathons, having bake sales and are fundraising. So that is 100% funded by the charity and the people, the huge community of people who so admirably fundraise for us. We don't get any funding.
I mean, that's wonderful, but don't you think you should have funding for the vital work you're doing, you know, from this massive central pot?
Yes, absolutely. That would be great. And it would allow us to expand it. Yeah.
Wow. Right. Okay. I'm going to come back to you, Ainsley, just now to ask that same question. Do you, you know, okay, well, there's a question been submitted by someone who's a carer for someone with leukemia. Should we, for instance, be taking this approach, this advocacy approach, this, you know, let's just get this done thing that appears to be behind it? I know that's not a technical term. Do you think we should be looking at that across the spectrum? Ainsley, for you.
Yes, definitely. I certainly found that we only really knew about motor neuron disease when we did the Ice Bucket Challenge. And my parents both participated in the Ice Bucket Challenge. And I think that's the first time I ever really looked into MND and understood it, and it scared me. It really, really scared me. And I remember thinking, I hope that never happens to us. And it was the worst thing ever. And I remember being so terrified, understanding what was ahead of my mum. I think any disease is terrible. I think neurological diseases are particularly terrible. It's the every disease is as important as the next. But the fact that my mum had that small time to actually absorb the fact that she's got this and then live out the rest of her life with it.
Yeah, for sure. And also, you know, there's the issues with the people with MND, but yeah, a lot's coming through on the Q&A about the need for support for carers. Susie, you know, should there be, in your opinion, more support for the family carers, unpaid carers, people that have been left really largely unsupported?
I would also like to say, in real life, I always refer to real life before COVID.
Yeah.
My mum would get a therapist that came from MND Scotland, and she would do Reiki or massage therapy, aromatherapy, and every 6 weeks I was offered it, a massage as my mum's carer.
It's basically
it was brilliant.
These third sector organizations that are making such a difference for you. And, you know, so the report upon which the National Care Service planning is being based really stressed the importance of the role of the third sector, charities and other organizations who specialize in, you know, things like MND. Ainsley, how important, how significant was the care you received from the third sector in terms of your overall journey?
Completely life-changing for me. Okay. It gave me breathing space, someone else to talk to. It gave me, I was a person again.
Yeah, okay. It's amazing. Here's a question that's come up. And, you know, if I can put this to Susie and Susan, is there an opportunity with this small group of people to trial a speedy service approach? Is there anything we could do to kind of model? I'll come to you, Susie, first, right? Can you bottle what you do? Can you train people? Can you share it? Can you know, promote this approach, do you think?
Absolutely. It's not rocket science. It is basically because we're not emotionally involved with what the family are dealing with. We can look at it objectively. We can hear what that particular family needs. And then through just us knowing the systems, it isn't rocket science. It's just about asking services to give what that family needs. and not to give up. You just keep pushing and pushing and pushing until that family are able to get what they need. I think the difference, what makes me so passionate about this job, is the time frame that people diagnosed with MND have. Everything is needed now.
You can't faff around, basically.
Absolutely.
Yeah.
And that makes me more passionate about ensuring that my client group get what they need when they need it. So yeah, it's not rocket science.
But it needs, and we come back to that investment word. Susan, here's Alex Thorburn contributing again, saying, although the Scottish Government introduced the right to advocacy for disabled people claiming through Social Security Scotland, for instance, they didn't prepare advocacy service providers for the huge increase in numbers that followed. Advocacy service providers cannot magic these fully trained advocates out of thin air, can they? What's your response to that?
It's a tricky one, actually, because yes, there is that commitment there. I mean, as a charity, advocacy will always be something that we will be long-term committed to. Likewise, as Ainsley highlighted earlier, we have welfare and benefits advisors as well, 100% funded through the charity. We will continue to do that as well, because not only do they have expertise in the system, they also have expertise in the illness as well, and the understanding of the need for speed. But I think if advocacy could be rolled out, because Ainsley highlighted just there that, if you don't know what you don't know, and we are a small charity, and I think if there could be a really serious commitment to the role of advocacy across social security, across social care, right across the statutory services that people need, that could only be a hugely positive thing for people, especially when you're talking about the kind of illness like MND, which is so 24/7 in terms of the carers that are providing that. There's no respite from it at all, and they really need that support that advocacy can provide. So if that can be rolled out across all these statutory services, that would be fantastic.
And it strikes me that we talked about community at the beginning of this discussion, and again, a key theme in the Feely report that underpins any National Care Service planning. Is there not a role as well for people living in community to, gain those skills and advocate for others? Could there not be a wider benefit to this? Susan, what, do you think that advocacy could have a kind of a role in community as well?
Maybe, as our advocate, I'll maybe ask Susie, would you maybe best placed to respond to that?
Yeah, I think one of the things that MND Scotland are doing just now, because we have recognised that quite often families are not coming to us early enough. They're coming, as in Ainsley's case, at the point of crisis. They're burnt out, they're exhausted, and they're just at a loss. And when they come to us, our job is very much reactive because it is crisis. What we're recognising now as an organisation is to try to alleviate that by, at the time when a person is diagnosed, and this could be the same for any condition, at the point a person is diagnosed, not only are they introduced to their MND nurse specialist, but they are introduced to a core group of first point of contact within MND Scotland. So it means that a family have got a contact person that they can phone no matter what the issue. And that first point of contact will then refer to benefits team or advocacy or equipment loan, and I would say that could work for any condition.
And you think that could be quite easy. Ainsley, I'm going to ask you for the last word on that one. Do you think, would that have helped you?
Oh, 100%. I think of the time that I wasted trying to find the right person to speak to.
Yeah.
And if I'd had Susie at the beginning, she would have told me, she would have said, I'll do that for you, or this is the person you need, here's the phone number. Now
we're down to our last 10 minutes. I told you this would go fast. We've got so much more. I could talk about this for hours. So this issue then, somebody has commented, Jim Guyan has commented, and I'm going to come to you, Susan Webster, on this one. Yet again, this shows the need for the third sector to be centrally funded as they plug the gap between the NHS and social care. But it's not just about central funding, is it? It's about being recognised as critical members of this team. Susan Webster, do you think that's achievable in a new NCS?
Well, I think
you're there as partners in care.
I would love to see us there as partners. I would absolutely love to see that. I think the third sector has an immeasurable wealth of experience in what is needed to support people, as well as being able to basically help identify what the problems with these systems are and what the solutions need to be. A wealth of experience, and it's really critical that we are equal partners, so that we're not kind of, I think, we respond to consultations and we respond to things, but to have us round the table from the beginning as equal partners would be phenomenal.
Are you optimistic that might happen?
I'm always optimistic.
That's a politician's answer, if ever there was one. I am conscious that we've got a lot of, there's a lot of talking we could still be doing, and there's been a lovely message put up. In fact, these conversations are so important. We need to influence investment being made in the right things that people actually need. And thanking you so much for sharing your experience and expertise. I'd like to add my voice of thanks to that. But before I come back and we close this session in about 9 minutes, I wonder if I could introduce, please, Lynn Williams, GCVS, also a carer, a very prominent carer, really, on our national media and on Twitter. Lynn, what have you taken from that discussion?
Well, firstly, thanks to Ainsley. From one carer to another, I know exactly how hard it is to share those experiences, and totally empathise with the trauma that you and your family faced over the last few years, because I think that's the only way to describe it, and that's where I want to start. I think, Penny, is that what I'm not seeing publicly just now is a full acknowledgement, and I've read the Scottish Government consultation a few times where it kind of hints at how bad things were pre-pandemic and how bad things are with the pandemic, because this pandemic's not going away anytime soon. So for me, I think the starting point has to be acknowledgement of basically how crap things are. I mean, to use a word that maybe isn't appropriate, but really what Ainsley has experienced with something like terminal illness that should never have happened is experienced sadly by many families across this country. And the reality of social care is that as a carer, as a family, we've chosen not to engage with social care because I honestly don't have the mental capacity to deal with that trauma. So it's easier for us to cope on our own as a family and not to have support than to deal with the bureaucracy that Susie and Susan have so eloquently talked about, and yourself as well, Ainsley. I think
would it have helped you if you had somebody dedicated to your circumstance to fight your corner as an advocate? I mean,
we work with a local carer centre who are massively oversubscribed. They're fabulous, but there's a limit to what they can do because of our circumstances. And I firmly believe that the quality of social care in terms of formal care would not meet my husband's needs. A 15-minute visit, what I do in 15 minutes is one task every day. It's one part of my husband's care. It's a tiny part of that care. We would need at least an hour plus for that. So yeah, so it comes back to quality, appropriateness of the care as well. And I think Ainsley, you would probably say that that's a case with your mum is when you have someone who's got complex needs, there's a system that's not geared up for that at all.
Definitely. And I think it's the importance of having that level of understanding that every person's different.
Yeah.
And what they rate as important might differ to what I think is important. And I think that's really
absolutely. So it's appropriate, and I don't think that's been discussed as well. And that's not the fault of care workers. I think Susan's point about investment in social care is critical. We're asking people on really awful salaries to do very, very, very skilled work. And to be trained at a level that, I what you did, Ainsley, what I do is nursing care. It's not social care. So there's a difference there. I think secondly, what we need to see is not a shifting of deck chairs again. That what needs to happen here is not more restructuring, because we've been doing that integration, and frankly that hasn't worked. So the focus needs to be on cultural change, on investment, and changing the system that actually works with families, not against them. And a last point I want to focus on unpaid care with my unpaid care hat on here. We've asked too much of unpaid carers over the last 10 years, I would say. And publicly, we're seeing partnerships asking families to do more. And over the last 18 months, they have done more without any support, without any recognition, without any financial support for many carers. And I have to say, I read the programme for government yesterday and was in tears, because yet again, you know, the sacrifices families have made over the last 18 months to support loved ones when things disappeared has been phenomenal, and yet it's simply not acknowledged. And in the whole debate around how we fund social care, around how social care looks, the role of unpaid care as the biggest provider of care in Scotland is completely ignored. And we cannot continue to rely on unpaid care to plug those gaps. So Susan's point about immediate investment, about doing what we need, so removing care charges now is absolutely critical. Getting investment to the front line to fund equipment, so people haven't had to buy that equipment. Things
or pay for private diagnosis.
Exactly. Yeah. So a lot of stuff we've bought privately ourselves. We buy our own pads, we buy our own wipes for my husband's continence needs. We don't get support from that at all. So it's a lot of stuff that people don't get, and I think just.
And then if I could ask you that critical question, in the short term, what needs to be done, Lynn, from your perspective as a carer that understands this system and has heard this discussion? What can be done in the short term to promote these principles?
Yeah, massive investment. It's not the immediate answer, but we need to have frontline investment right at the front. We need to pay social care workers a decent wage. We missed the opportunity before the end of the last Parliament to do that. We need to be funding the role of MND Scotland and others.
What about advocacy across the board as well in social care?
Yeah, absolutely. So the role of third sector organisations who provide that advocacy and support, that kind of shoulder to cry when you need it, so often, they need to be better funded. Absolutely, they are mission critical to this whole agenda. And best support unpaid carers.
Now I know we're running really down to our last seconds almost. GCVS is doing a lot of these discussions, and this has been a really fascinating one that for me, you know, has shown some real ways ahead. What are you going to do with the comments that have come in and what we've heard today? What are you going to do with this information? And you've literally got a minute.
I think Sheena in as well, obviously, because she's the boss.
Yeah, go on, Sheena.
No, but I think we will be using all of this to respond to the National Care Service consultation, almost certainly. There's so much that we've gained from these sessions. So the words of Ainsley, the experience of MND Scotland, the role of the third sector, we will be emphasising that and pushing for that, absolutely.
We're also recording this, Sheena, I think. You know, are we going to share this discussion so that other people who haven't been able to take part hear this?
Absolutely. Yeah, it's really important that we share the discussion, we share the learning. In my role is about improving the relationship with the Health and Social Care Partnership and sharing people's stories, sharing the reality of decisions that are made, I think is really critical. That we're, you know, when people make a decision, they maybe don't realise there's I talk about real live people, you know, we're not talking about. This is
also highlighting the role of the third sector, isn't it? And that we mustn't lose that, because the discussion at the moment, UK-wide, has been about NHS and social care. There's very little reference at the moment to third sector. We mustn't lose that. I've got 1 minute left. I'm going to thank so much everybody who took part in this, and particularly Ainsley for sharing a story that brings this into stark perspective.
I'm very humbled to even get any sort of thanks, because I really feel that the true superheroes are the ones with their microphones on mute right now. I'd like to say thank you personally to Susie and Susan. MND Scotland changed my life. Thank you so much for everything.
What a fantastic thing to hear you say to close this. Just to remind anybody that can attend or has already booked, on the 8th of October at 10 a.m, there is the rescheduled Our World Reimagined special with Scottish Government Minister Kevin Stewart, MSP. If you want to know more about that, keep in touch with GCVS. And on the 16th of September, so very soon, at 2 p.m, there's a joint session with the Scottish Women's Budget Group looking at social care, gender, and whether a national care service can help create a care economy. That brings us to noon. I'm going to say thank you so much and have a great afternoon. Bye-bye.